Hi, I'm Dr. Randy Kamen. Welcome to Strategies to Spark Your Week. Today I'll be talking about anxiety and depression, along with how to tell the difference between a panic attack and a heart attack. I want to start by speaking briefly about anxiety and depression because they are the hallmark feelings that bring people into therapy. Anxiety and depression typically mask these deeper emotions that we want to avoid or dare not to feel. Depression, for example, occurs when we suppress our feelings and become numb, whereas anxiety takes hold when we take flight from emotions and enter into a highly aroused state. Either way, we are avoiding the real feelings that lie beneath the anxiety and depression. Unconsciously, these emotions are sometimes simply more than we can bear. However, when we train ourselves to slow down and become curious, to observe, explore, and experience our true feelings, we are poised then to move through and resolve these difficult feelings. That is when we are liberated to go forward in our lives in a healthier way. Anne, a patient I had been working with for some weeks, who came for her chronic feelings of anxiety, arrived at my office at her regular time. But today, her hands trembled as she handed me a hospital report. I soon learned that she spent the weekend at the hospital undergoing tests. She said with great sadness, "I felt like I was having a heart attack. I was terrified that this is what it was. I was scared, not so much for me, but I could not bear leaving Stephen, her husband, and my children." Anne huddled on the couch, wrapped her arms around her thin body, and waited for my response. Thankfully, that's not what's going on as I scanned her medical record. Your report indicates slightly elevated blood pressure, which can be managed through medication and making some lifestyle changes, like the belly breathing, meditation, and some of the practices that we have been discussing, like fresh air and getting exercise. Needless to say, I told her, the smoking is making matters more complicated, but let's just take one step at a time. I reviewed the belly breathing that Anne had not yet put into practice on her own. My hope was that this time she could begin practicing this simple method on a regular basis, which I knew would not only calm her down, help her with smoking cessation, but offer many other benefits for her mind and her body. Other than the slightly elevated blood pressure, Anne had a clean bill of health. That said, panic attacks, even though not life-threatening, can be terrifying. Again, I assured Anne, these well-researched and effective relaxation strategies can be incorporated into her everyday life to protect her against the devastating effects of anxiety, panic, and overall stress. These methods not only reduce anxiety, stress, and help quiet the mind, but they also open up opportunities to savor more of life's positive experiences. I wanted Anne to really get that physical symptoms like high blood pressure were at least in part a function of emotional stress and were not simply a medical problem. I also told her, sometimes bringing up the past, as in therapy, a heart-to-heart conversation, or even thinking or dreaming about the past, has the potential to uncover long-buried feelings that can result in anxiety or panic symptoms. It's not at all unusual to feel tense, scared, or angry when you delve into a painful past, which Anne was in the middle of doing in her therapy. Anxiety is the body's natural response to danger, real or imagined, current or past. I told her that I thought our last conversation about her sister's ghastly suicide brought up a traumatic memory that probably ignited her panic attack. Anxiety and panic are often used interchangeably, but one of the distinctions between anxiety and panic is that with panic, there is a sudden and dramatic onset, whereas anxiety can be less intense, although painful, and more nagging and persistent. Sometimes, as in Anne's case, severe anxiety or panic can mimic a heart attack. When this happens, it is always wise to get medical attention when you think you might be having a heart attack, even if you think it might also just be indigestion or acute anxiety. As a very important aside, I'd like to take a couple of minutes to talk about women and heart attacks. Heart attacks are the #1 cause of death in women in the United States. So it behooves you to check out symptoms when you experience them. Also important to note is that heart attack signs in women are different from that of men, as most of the heart attack research has been done on men or male mice. The following symptoms are typical heart attack symptoms and signs for women. 1. Uncomfortable pressure or squeezing, fullness or pain in the center of your chest that lasts more than a few minutes or goes away and comes back. Pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath, with or without chest discomfort. 4. Breaking out in a cold sweat, nausea, or lightheadedness. 5. As with men, women's most common heart attack symptom is chest pain, or more likely, pressure or discomfort. However, women are more likely than men to experience other symptoms, especially shortness of breath, nausea, vomiting, and back or jaw pain. If you have any of these signs, don't wait more than 5 minutes before calling for help. Call 911 and get to the hospital right away. Now back to Anne. Typically, medication is the first line of defense used to alleviate the initial symptoms associated with anxiety or a panic attack. Some of these symptoms include racing heart, feeling weak, faint, dizzy, a sense of terror or impending doom, sweats, chills, chest pain, breathing difficulties, and a feeling of loss of control. So you can see there is a good deal of overlap between a panic attack and a heart attack. It's therefore easy to understand how Anne thought she was having a heart attack, and it was extremely smart of her to check that out. After the initial use of medication for anxiety or panic, it's best to pursue psychotherapy, cognitive behavioral therapy, relaxation, and meditation training, as these methods have been shown to be highly effective over the long term in helping people control or overcome these highly uncomfortable, scary symptoms. Also, these practices enable patients to replace irrational, maladaptive, and self-defeating thoughts with more positive and realistic ones. After Anne's panic attack, I began to wonder what else she might not be telling me, as she kept the family code of silence locked firmly in place. I decided to bide my time and focus on teaching her skills that would help her control the physical and emotional symptoms that brought her into the emergency room and into my office in the first place. I told Anne, learning strategies to improve your resilience will help you calm down and take control before the anxiety takes control over you. You will also be better able to ward off future panic attacks and minimize the impact of the ones that might break through. Perhaps after you internalize these skills, you will also feel better prepared to speak more openly about your past. Although recollecting a difficult past may exacerbate emotions at first, over time it is possible to feel calmer and more at peace when you share your story with someone you trust. We all face anxiety and intensified emotions at times, but it is so important to remember that even the most powerful feelings reach a peak and then subside, like an arc or a bell curve. Intense feelings never last longer than a minute and a half. They always come down. Even the most extreme emotions cannot sustain themselves. What goes up must come down, and this is certainly the case with intense feeling states. With the practice of relaxation methods, it is possible to learn to ride the wave of emotions with the understanding that they will eventually level off. This is true of any emotion. Conscious deepening of the breath when emotions run high deepens the capacity to tolerate strong feelings. Just remember that the best thing you can do when you have an anxiety or a panic attack is to breathe deeply, making sure to exhale completely, like blowing into a paper bag or a balloon. As the relaxation occurs, on the exhalation phase of the breathing, as you breathe out, as you breathe into that bag or balloon, then return to regular belly breathing. If symptoms persist, seek medical attention. I hope this talk sparks you into a calm and energized week. Please let me know if you have any comments or questions about the relaxation or meditation, or even about the anxiety. I could be reached at my website, drrandykamen.com. You can also follow me on Twitter. My Twitter handle is Dr. Randy Kamen. I look forward to seeing you next week for another episode of Strategies to Spark Your Week.